Olá pessoal, tudo bem? Eu sou o Francisco da 3RA Intercâmbio e estou aqui hoje com a nossa querida Tara da Guard-me. How are you doing, Tara?
I'm good, how are you?
Good, good. Thank you so much for coming. Thanks
No problem.
for coming, like answering all the questions that we're gonna have for you, right?
Yeah, of course.
Ok. Então, pessoal, nós vamos fazer uma apresentação para vocês aqui do Guard-me. A Tara vai falar um pouquinho sobre o seguro de saúde, tá? Esse é um seguro de saúde para estudantes, tá legal? Ele só funciona para estudantes. A 3RA Intercâmbio utiliza o Guard-me, a maioria dos colleges, também no Canadá, e escolas de inglês. Nós todos utilizamos o Guard-me porque eles prestam um serviço muito bom e o valor deles para estudante é incrível. Para vocês terem uma ideia, um mês, né, de seguro pela Guard-me na 3RA Intercâmbio gira em torno de $66 canadenses por mês. Provavelmente é menos do que você paga no seu seguro de saúde aí no Brasil, né? So, Tara, they all yours.
All right, great. My name's Tara. I'm an account manager here at Guard-me Insurance. So I help everyone here in Vancouver with their Guard-me insurance, including everyone here. So a little overview about Guard-me Insurance. Guard-me is the private health insurance that you need if you're here for short term or if you're waiting for the provincial MSP insurance. We provide things also that the provincial insurance doesn't cover as well. So health insurance is expensive in Canada and students are here to study, so we like to have a comprehensive plan that's directed just for students, really. So.
Oh, it's great, right? I think you mentioned that it covers a few things that even the government plan doesn't cover.
That's correct.
And which is great. I had a student that he kept for quite a few years, both.
Yeah.
Even though he had the MSP, which the government shares here in BC, he still had Guard-me because it was covering things that wouldn't the insurance from the government doesn't cover, right?
Right, and that's very smart.
Yeah,
very smart.
The price is really good, right? So it's an option. Okay, so go ahead.
So students will all get a Guard-me ID card, whether that be electronic or an actual card to put in your wallet. Please, please, please don't lose it. This card has really good information on it. It also has a 1-800 emergency number. So you can call our office. It's a Canadian office. Someone's available 24/7. We have translation services. So if students don't feel comfortable speaking in English, they can request a translation service, and it's available to them at any time.
Okay, one thing that you guys have that I find that is great, it's that on your website, students can go and they can go and pick where they are, and they can see exactly which clinic accepts Guard-me.
Yeah, exactly.
Because what we say in a perfect world, even the hospital here would take Guard-me, right? But it depends of the person that is in there. Usually, if you end up in a hospital, you're probably gonna have to pay, and then Guard-me is gonna do the refund for you, right? But if it's not something serious that you have to go to a hospital, the Guard-me has a list of clinics that you can go on the website. You see whatever is more convenient for you. Give them a call. Make sure that they are open and everything, and you can go straight to the clinic, right? You don't have to go through a bureaucratic process before you go to the clinic.
Right.
I find that's amazing.
It is. It's really helpful.
Yeah, we used to work with another provider, insurance provider, before we start to work with you guys, and that was something that was always very complicated. Like to get our students to go to a clinic, we would have to go through a process.
Right.
And when Guard-me came to us and present your product, and they say, oh, you can go in the website and check. I was like, really? I was skeptical. I was like, I didn't believe at first, and I phoned a lot of clinics that was in there. I said, okay, I have Guard-me. If I go to your clinic, I have to pay, and you guys are going to do the refund, or I just use my Guard-me card. And all of them, they said, no, you can just use the Guard-me card. I was like, that blew my mind.
Very easy. Well, like I said, we cater to students only. We don't do house insurance. We don't do boat insurance. we only do insurance for students. So we
Oh,
can
you guys
really
are good in what you do, right?
Exactly. We can fine tune how we work with the students and make it the easiest and the best for them. So
Yeah, that's I found that it was amazing, right? And I believe that's why like the education industry loves to work with Garden.
we do.
Because like they have a very simple process if you need to use insurance, and the cost is really good.
Right.
So that's amazing.
Right. Yeah.
Okay.
Okay. Like I mentioned, healthcare is expensive in Canada, so that's why you have your GuardMe plan. You can see here some of the prices are really expensive. Some of the GuardMe Canada highlights are students who have a new emergency or a new illness. They can go to the doctor, they can go to the hospital, the emergency room if required. We do cover the ambulance ride and prescriptions, so any prescriptions that are prescribed that are new. Dental accidents, so not regular dental coverage, but if there's an accident that happens, if there's a blow to the mouth, we can cover that. Family transportation, so in the unlikely event that a student is hospitalized for more than 7 days, we can bring 2 of their family members over so that they're not by themselves.
I remember the first time that I contacted GuardMe was a sad time for the Brazilian community here. He was a young kid that he died in a ski accident, and it was really hard like to get a hold of you guys, because the whole team, that kid was insured by GuardMe, and you guys were transporting the family here
Right.
for like all the procedures, right? But sure, it was a sad time for the community here.
Right.
But I could see that you guys were providing like a good service in a bad moment. You had someone there to help you out. So I remember by that time, GuardMe brought the whole family here to reunite with the kid and take back to Brazil, right? So
yeah, we have a special team that's dedicated to critical care cases, just like that. Special team that's dedicated to just cases of that nature. So we have very specialized people working on these cases, and unfortunately we've been through a lot of them, so we have a really good process of making it easier than it should be, right? Because it's a hard time, so we try to do everything that we can to alleviate.
Well, we expect that like the person doesn't need to use GuardMe for sure.
Exactly, we don't want anybody to have to use it.
Don't come to Canada without insurance. Like the prices for, if you end up in a hospital here, they're gonna be huge. Right. So fortunately, we don't have many cases of students that had like big problems, but we have some.
Right.
We had a student that had a stroke inside of the subway and things like that. So the whole team at 3IA goes like to help. And we have the backup from GuardMe, which is amazing, right? So don't come. The price, the student insurance, it's really cheap compared to what you can like end up with a bill here, right? So it's just an amazing product for like a very low cost. So don't do it. Don't come here without without insurance, right?
Yeah, exactly. So if we want to look at some of the things that are excluded, just so students know, any treatments that aren't medically necessary, like Botox or cosmetic surgery, things like that aren't covered. It's not.
You're talking about dental, right? If it's or a procedure to go to the dentist, that isn't.
Or teeth whitening, so something cosmetic that's not an emergency. So something that can wait until they go back home wouldn't be covered. If it's an emergency and something needs to be dealt with right away in Canada, then if it's an eligible benefit, then it's covered. If the doctor says it can wait, you don't need it now, or this is a cosmetic thing and it's not something you need medically, then it's not covered. Same with...
It's insurance, not a plan, right?
It's for emergencies, right?
Exactly. That's how I used to explain my students. Like, we want you when you get here, depending on the province that you are, if you come here to study, if you have the right to apply for the government plan, do it, because that's a plan, right? GuardMe is insurance, but it covers a lot of things that sometimes the government doesn't cover, right? Physiotherapy, how that works?
Physical therapy, if it's recommended by a doctor based on a previous event that happened, then it would be covered.
Because this student that I had, she was here as a student, like she was studying English by that time, and then she had an accident, and then after she applied for the college, so she got the government like plan, but she kept GuardMe because like the GuardMe would cover the physiotherapist, but the government wouldn't do it, right?
No.
So it's a smart choice for a low price.
I think so, and you know, we want students to be here to be healthy and happy to study because they're here in Canada to study, and anything that gets in the way of that, you know, we want to be able to fix that if we can. So if it's an emergency or they're sick, you know, we want them to get back to be able to study because that's what they're here to do, and we don't want them to have to spend their money on other things when they're trying to spend their money on school, right?
For sure, that's for sure.
Yeah. Yeah, so we can go to the next. We were talking about clinics earlier. So for clinics in Canada is for minor things. So like you said before, a student can go to our website, they can put in their postal code to find a clinic. If a student needs to know when to go to a clinic, it's for mild things. So stomach ache, headache, flu, just not feeling well. So for minor things, not emergencies. They can find a clinic nearest to them. But so we do have another function called Mobile Doctor, which is really great. A student can use their phone or their tablet or their laptop if they don't want to go to a clinic, if it's raining and it's cold and they don't want to go outside. They have 24/7 access to a Canadian doctor right on their phone. They can type in their symptoms, be connected to a licensed doctor here in Canada, and get a prescription for whatever ails them.
That's amazing.
It is. It's
I
really
didn't know
great.
that. I didn't know about that. For sure my team knows, right? Because my team guides like our students, right? But it's amazing.
It's really great. So it's a good option instead of going to the clinic, and it's a lot faster too. So that's another great option for students.
For sure. Perfect.
Yeah. In the event of an emergency and students have to go to a hospital, we do try to make the process as easy as possible. So hospitals here in Canada are for emergencies only. So car accident or ski accident, things like that, we can have a student go to the hospital. Like you said before, also, not all hospitals will direct bill to GuardMe. So a student, if they are admitted to the hospital, can call us. So we really, really encourage students to call us as soon as they can. To let us know.
Usually here at TA we help the students with this process,
and that's
right?
Great.
Something like that. We help the students like through to guide them.
Right.
If it's a point that we have to ask for a refund, or maybe even not a refund, because here in Canada you have that option to ask the hospital to send the bill to your home, right?
Yeah.
So we have some time to work with GuardMe.
Good.
So you're probably not gonna be obliged to pay the bill and then GuardMe do the refund, right? Because we have that time. So maybe we direct that bill to GuardMe, and you guys can deal directly with the hospital, right?
Yes, we can. So if there is a staff member with a student or even a friend, we do encourage them to call. And we do have dedicated care team members that answer the phone that can help a student through that process, even if there isn't a staff member with them, because it can be scary for them to be in a hospital in a new place and have an emergency. So we always have someone that can walk them through the process.
And remember to call 3RA. We are gonna do our best to help you out. We had like in an event here, we didn't have anyone to send to the hospital, so we sent someone from finance at 3RA, someone that works with finance. Doesn't matter, right? Like, because the student needs a translator. That person didn't speak any English, so how come he was gonna deal with the doctors and everything, right? So the person that we could send was someone from finance, and she knew English. Yeah, that's like what she had like to know, right? So we sent her to to the hospital and to help the family and that student, and it was perfect. So call GuardMe and call us, because we are going to do our best to help you out like as fast as possible.
Exactly. Yes. Great. If students do have to pay up front for a clinic visit, or if it's a test at the hospital, Submitting a claim is super easy. They can all do it online, so on their phone, on their laptop, super easy. Just request the medical records and the receipt and upload everything, super quick. And then they'll get an email to say kind of, this is what you need, or we have everything. You'll get a decision within a couple of days or a couple of weeks. If not, we can always ask the hospital for more information. So we can go through that. There's different ways to get the reimbursements. Direct deposit, if a student has a bank account in Canada, is probably the easiest. Wire transfer, so if we know a student's going back home, say in a week, we would probably want to choose wire transfer so that it can go back to their home country and they don't have to deposit it here.
As an agent, can we receive that money if the student doesn't have an account here in Canada and pay the student? Is it possible to do that?
You could, but in that case, they can always request wire transfer and it can just be sent back home and it doesn't have to.
I was afraid of the bank fees.
We don't charge a bank
but
fee
not,
for the wire
not you
transfer.
guys, the
back
banks.
Home, yeah. I suppose you could. We could also do a prepaid debit card. So a student would get a virtual and a physical prepaid debit card and it would come to them here in Canada and they could use it just like any other debit card.
Okay.
Or a check.
There you go.
Okay. And of course,
well, just a second. So the bottom line, guys, is that like sometimes it's case by case, right? Something like that. But 3RA, it's going to be behind to help you out, like in a case like that. We're going to talk to Garmi. One thing that I love about them, they are very open to to help the student in like whenever they can, right? So we're gonna be here, talk to them. Let's say, oh, you don't have an account here, you're going back. Well, the wire, let's say it's $50. $50 is gonna be like the fees that the bank are gonna cover. So we don't want our student to lose that money, right?
And we don't either.
So so we can try like to have that money transferred to us, so we pay you, things like that, right? Yeah. So we're gonna work together.
Exactly. Yeah, I think we have a great partnership and I can look forward to continuing this and I love meeting the students. So of course students can contact us anytime. We do have FAQ videos on our website that if a student wants to look them up at any time, those are there. And of course 911 for ambulance.
Oh, yeah.
That's a very important one. And the 1-800 emergency line on their ID card. So that one's very important as well because there's always someone that's going to be there to help.
Perfect, perfect. So let's go to the questions?
Sure.
Okay, so let's, I believe that we already answered some of the questions here, like during our chat.
Probably.
But let's see here. Someone asked for dental, routine, doesn't cover routine,
Correct.
right?
Yeah.
So medicaments, that would cover if it was something that a prescription that was, someone gets hurt here, like it has to take some, I don't know, pills or whatever. Mm-hmm. So how like that, so the government covers the prescriptions?
So new prescriptions, not a prescription that the student was taking before, but a new prescription up to 30 days. But anything that's over the counter, like Tylenol, Advil, Tums, those aren't covered. But a prescription that the student needs to go through the pharmacy, those are covered for up to a 30-day supply.
Okay, perfect. Let's say our students here in Canada and decides to spend the weekend in US.
Yep.
So how would the student be covered in US as well?
Yep, the student's still covered in the US up to 30 days. I hope they're not in the US for 30 days because they're here to study. But the student is covered in any country except for their home country.
So that's great. I remember like first time that I spoke with Academy, so if you're here, you're traveling anywhere in the world, you have coverage besides back at your own country. So if you're back in Brazil, you're not gonna get the coverage. But if you're here, the most common for students that come to Canada is to travel to US, right?
Right, to go shopping, right?
Oh yeah. Well, if someone has already, for sure, that's a basic for all insurance, right? But if someone has already something like back in Brazil and needs prescriptions here, so that doesn't cover, right? I believe we talked about that already.
Right, pre-existing conditions aren't covered.
Okay. That is not going to do it. Another question is, this is very common in Brazil, we call carência. Yeah, when you get insurance, there is some time that you cannot use the insurance. With GuardMe, the student can use the GuardMe right away, right?
Right. So with the policy start date on their ID card, their policy and their benefits start on that date, and then they'll continue through until the policy end date. So there's no waiting period, and there's no co-pays, there's no deductibles. So if it's a listed benefit in the policy, we cover it 100%.
Perfect.
Yeah.
And how about if the student gets pregnant?
So if a student...
That's a big question, actually.
It's a very big question, but it's a good question.
Especially when in Ontario, if let's say a student comes to study in a college or university in Ontario, they cannot get the provincial insurance in there, right? So in this case, we insure our students with GuardMe the whole time that the student is at the college or university, right?
Right.
Things can happen, right?
Right. So the pregnancy cannot start before the policy start date. So the pregnancy would have to start after the policy start date, but to be eligible for the pregnancy emergency benefits, the student would have to have their GuardMe policy throughout their whole pregnancy, so the entire 9 months.
For sure, but if the student has, let's say I got GuardMe today, 3 months later I'm pregnant. So there is routines like there's a visit, some routine is in the visit to the doctors. Would GuardMe cover that or not?
Routine and regular checkups that are required aren't covered. However, if there is an emergency, they're covered in the event of an emergency, and they can find those exact details in their policy, just not the regular day-to-day routine checkups that are required during the pregnancy.
Okay, so how about the day that the baby comes? So mom has to go to the hospital and so on. So would the mom and the baby be covered? How would that works?
If it's a normal delivery, if everything goes according to plan, then they still have to cover the pregnancy on their own or the delivery. If there are complications, we cover complications. We don't cover normal delivery. We only cover anything that would come up as a complication.
Okay, I see.
Right.
Well, that's usually what we talk to nobody wants to have a complication,
exactly.
Right? So we tell our students that want to come and get a baby here in Canada, wait until you get the government plan.
Exactly.
Because I think for these cases, it's the best, right?
Right. For pre-existing conditions in pregnancy, the provincial insurance is the best. But just for general coverage or extended coverage, partial extended coverage, GuardMe is probably a lot more practical for students.
For sure. Ok,
Tara,
thank you so much for your time.
Yeah, no problem.
Pessoal, espero que vocês tenham gostado do nosso bate-papo, né? A GuardMe é a provedora de seguro de estudantes para 3RA intercâmbio. Como eu falei, gostamos muito de utilizar eles pela praticidade, tá? E pelo valor, né? É um valor muito atrativo, né? A 3RA já recebeu propostas de seguradoras do Brasil, né, para trabalhar com seus estudantes, mas os valores eram, para os nossos estudantes, era algo que eu achei muito alto, né? O intuito da 3RA é carregar o interesse do seu cliente no coração, né, e trabalhar com tudo que for que tiver o melhor custo-benefício, né? Então, assim, a GuardMe é uma grande parceira da 3RA Intercâmbio por oferecer um excelente custo-benefício. Como eu falei, geralmente um mês, né, de cobertura, né, em torno de $66 canadenses. Provavelmente é menos do que você paga aí no Brasil como seguro saúde, né? Thank you so much, Tara. Sorry about the Portuguese.
No worries.
There's a few things that it's easy to explain in Portuguese.
That's great, no worries.
Thank you so much.
Thank you.
Obrigado, pessoal. Até a próxima.